Hi, this is Dr. Randy Bach. I'm pleased to have another coronavirus conversation on our Facebook page, Viral Conversation, and elsewhere on Twitter and YouTube. I'm honored today, July 20, 2022, to have with me Dr. Gary Sidley, who's a consultant psychologist, now retired in the UK. He's living in Lancashire, and I was pleased to have him to get to watch his lecture recently on a group called pandata.org, and he talked about the British nudge unit, which has kind of spy connotations. I think in an age of war, disinformation, misinformation is potentially appropriate. And the question is, what war were we in, and did we need this? So I'm going to turn it over to Dr. Sidley. Maybe you can elaborate on my introduction and tell us a little bit more about yourself and how you got interested in the subject matter at hand.
Okay, I'll try and keep this brief. I worked in the NHS in mental health services for 32 years, initially as a psychiatric nurse, but then for the most part as a qualified clinical psychologist, working with adult mental health problems. I did that up until 2013, when I opted for early retirement. From that point, I was a campaigner really for better mental health services. I did, and I still believe we can offer people in emotional distress much more effective service than we did in my time. It was ways of improving that. So I spent my time as a campaigner, working in various groups, trying to improve mental health services. Right up until 2020, of course, when the COVID era began, early 2020. And I knew from the outset, I was arguing about this in February 2020, that this wasn't right. We were on the cusp of something that was not going to be good, to say the least.
How did you know that? What were the signs for you?
Yes, it's a good question, and it's almost quite difficult to pinpoint why some people know that this is wrong and other people really struggle and still struggle. I think for me, there are probably two, maybe three reasons. I think one was that as part of my work in the NHS, I had spent a fair bit of time working alongside infection control people. Yep. And I don't want to slur the whole profession, but even though I think they often are well-meaning, I always got the sense that they were quite narrow in their focus, struggled to see the bigger picture, and often came up with pretty impractical suggestions. I also, one of my main interests, my PhD, my research doctorate, was in risk around suicide, and with a focus on how good or not so good we are at assessing risk, future risk. And so I realized that risk assessment was not a particularly rigorous process. It was very difficult to predict risk for people. And there was this terrible tendency in mental health services to be risk averse, so that we would crush people, won't let them take any chances.
No, it's a funny thing. I think people have a hard time kind of figuring out the orders of magnitude difference between certain things that can or might happen. And I think people have a natural biologic clear fear reaction. I mean, we have a lot of number of rabbits in our garden these days, and it's very useful for them to have a high perception of fear, because they're rabbits. They're tiny, they're delicious, and they are herbivores, so they're going to be sitting there munching for a long time in the open. And so it's reasonable for a bunny rabbit to be scared, less so for a lion if you're higher up on the food chain. I think we're pretty high on the food chain, and we don't really have that many. I don't think we have any real natural predators right now. So I think our biologic fear has somewhat transmuted to these things that we we still have this fear need. And we kind of transmit it onto our transmuted onto other things. And I think other people are aware of that and can try to, kind of change the amplitude and the volume on the things that we have out there. If we're not in fear, we're not as easily led or guided by those of us who, by those around us, our leaders who might, somehow benefit from leading us, even, at times when we don't really have that much to fear.
Mm. Yes, that's right. And when we do get risk completely out of perspective, I think. Like I'm sure you've heard this, Randy. I know I have throughout this COVID era. I've heard people say to me, Gary, if something can save just one life, surely it's worth it. And
That means you should never get in an automobile.
Well, exactly. I tend to respond to that one rather more flippantly for my sins. I say that apparently there's a cluster of people who die each year while putting their trousers on because they fall over and crack their heads.
Yeah, no, it's true. Our former president's ex-wife, Ivana Trump, sadly and tragically, she's only 73 or so. She died like a week ago, and it turns out she fell down her spiral staircase. And New York doesn't have many of them. New York City does not have many spiral staircases, and so I assume she's in a duplex in a penthouse apartment kind of thing. And she tripped, she fell, she died. And so that has totally stopped me from climbing the stairs. It's stopped me from having any aspirations to purchase a penthouse apartment, and wearing high heels. I've totally given that up.
Okay. Absolutely. But as I was saying, I think there's probably three reasons why I was aware that this wasn't right. I think one was because I guess I'd had contact with infection control before. Two, I think it was well genned up on risk and risk issues and risk aversion. The other one, which kind of evolved in time, was that I was always aware of how, well, let's not mince our words, how corrupt Big Pharma is, and it has been for decades. In mental health, I did a lot of work looking at people who have been on medication all their life and the way that the pharmaceutical industry pushed these things at people, and just looking at some of the criminal charges that have been brought against the major drug companies over the last 2, 3, 4 decades. It's quite staggering, really. So I kind of knew that as well. So I think all those three came together and suggested to me that this didn't sound right. So I started to do my own research then and dig a bit more around figures. And
so I'm going to get into that research in a second. I just want to give one kind of counter narrative thought, which is that if the pharmaceutical companies had a judicial wing and they could look at the political classes, and if we saw politics as an industry, I would venture to say that politics is probably slightly more manipulative and corrupt than the pharmaceutical industry, which at the very least does have some useful products, antibiotics and whatnot. And I think that together, they formed kind of a perfect storm, which is a book title. But I think the pharmaceutical industry has its interest, and they're good at making vaccines in this case, or medications. And the political class, I think, was fed by the potential kickbacks from the pharmaceutical industry. I don't think the pharmaceutical industry is kind of corrupt in a vacuum. I think to be corrupt, they have to have a partner in corruption who's willing to manipulate the facts and the science in order to work for themselves. I mean, the kind of there were pharmaceuticals out there, mind you, that theoretically could have been useful, especially in the absence of a vaccine the first year. But they were quashed because they were not moneymakers. They were off patent. Ivermectin and HCQ, and I'm not espousing those per se because I don't really know whether the data has been conclusive one way or another. But the fact that they were vilified, even though they are pharmaceuticals, points to the fact that it's not just pushing pills per se, because these pills were not pushed. It was really that we're going to hold off for the big guns, the moneymaker, which is the vaccine, which is now being pushed to children 0 to 2 years old who have had a grand total of zero mortality throughout the United States to date from COVID. So let's get to your
just on that though, Randy, I agree with you that the pharmaceutical industry aren't alone in misdemeanors. This whole kind of pandemic industry, I think, that kind of has some kind of symbiotic relationship. It's the political classes with the scientists, the pharmaceutical industry. So yeah, I think it's a mutually beneficial arrangement, but I don't think it's one that's in the interest of Joe public. Really, that's my kind of stance on that. Okay.
What was the pathway you took, and what has happened with it?
Yeah, well, I started to dig and started to research. I joined pretty soon an organisation here in the UK called the Health Advisory and Recovery Team, the HEART for short, which is a multidisciplinary group of experts who've tried to disseminate a different narrative to what's been pushed by the mainstream. So that's been fun, as you can imagine, with all the censorship and the vilification. That's been lively, to say the least. But we've hung on in there, and I like to think we have had some influence, at least here in the UK. I also joined a group called Smile Free, which is
Oh, that was really interesting. I actually went to the webpage, and I love this. Maybe while you're talking, I'll try to pull it up so people can see what it is briefly.
Yeah, it's a little bit, again, just like Heart. Everybody's volunteers on Heart. Like, we keep getting accused in Heart of being these funded by right-wing organisations. So I wish I knew where this money was coming from, because our funding is every 2 or 3 months we all throw a tenner in to keep the website going. We're all volunteers. And same with Smile Free. It's a very small group.
What's the URL for that? Do you have a
for Heart? It's
Smile Free. Is that the same?
Smile Free, smilefree.org.
Okay.
Yeah, smilefree.org.
Okay, carry on.
And so, yeah, I got involved with Smile Free, which is a group that's been very much against mass mandates. And that battle here, I don't know what it's like in the US, but the battle here is continuing, because we had some successes and masks have been dropped, and we're beginning to get them even out of healthcare as routine kind of wear in healthcare for visitors. But sadly, that seems to be coming back over the last couple of weeks. So there's still a lot of work to be done there, I think. So I kind of got involved in these various things, and most recently in Panda, which is where you saw me do my presentation. So really just spending my time really trying to challenge what I think's the biggest threat in my lifetime to our basic human rights and freedoms.
Yep. So I just graze through your site a little bit for people, and they can find it just where you said.
Yes, lots of good stuff on there. Lots of videos, lots of interviews, lots of references, some really good written materials. So yeah, I recommend it if anybody who's concerned about masking the healthy.
So I don't want to compare ants to lions, but there was a fair amount of misinformation going on, purposeful mis or disinformation. Joseph Goebbels, the smiling face of Nazism, purposefully went about doing a fair amount of this for his war effort, and no doubt the good guys have done the same in war. Did COVID rise to the level of war, and did the lies rise to the level of wartime misinformation?
I think it did. Yes, I think the thing about misinformation and propaganda, as we know, is it's been around for a long, long time in various guises. But I just think there's something very different about, certainly peacetime, at least in the COVID era, is the intensity and the sheer kind of this breadth of misinformation. And all the media, in our so-called civilized democracies, all the mainstream media, and I suspect it's the same in America, but correct me if I'm wrong, but just it's been pushing out the mainstream narrative and without any real opportunity to challenge it or get your voice heard. I'm this member of Heart. I've spoke with colleagues who, in the early days, actually got as far as being asked to go on the mainstream media to give their views until the producer before the program said, "Broadly speaking, what are you going to say?" And when they actually told them, said, "Oh, well, you can't come on then."
So what did you say you were going to say?
Well, that wasn't me. That was a colleague. This was a cancer expert, professor of oncology. I won't name him because I haven't got his permission. But he was going to say that a lot of cancer victims were being neglected because of this obsession with COVID-19. I think that was his
Right.
his argument that the hospital had become, the NHS service, National Health Service, had become this COVID service. And people were, being scared of attending hospital. Other services were being dropped.
No,
And
it's absolutely true. I had a gentleman, Dr. Paul Frieters, as an interview a couple months ago, and there's a thing called QALY. He actually has another unit called WellBe. The QALY is a quality adjusted life year, and I think it's inarguable that we've lost more quality adjusted life years, and he's got a different unit called a WellBe, which is more precise, from the response to COVID than from COVID itself, because the people who were neglected and or died because of diseases, despair, drug addiction, depression, suicide, and whatnot, they lost more relative years of their lives than the median age 82 sad but older victims, as it were, of COVID-19 itself.
yes, that's right. And that was the kind of point he was making, not necessarily in those terms, but he was saying that the collateral damage of the restrictions would be, more damaging.
Yeah, well, not just specifically for cancer, but in the United States, I think there were, if you look at excess deaths, there were something on the order of, I don't know, tens of thousands, I think 30 or 40,000 more opiate deaths in the year that COVID restrictions took place in the 12 months than there had been the prior. And those are median age like 35 to 40. And, who knows exactly what the quality of their lives are going to be if they're going to overdose on heroin or fentanyl. But just the mere concept that, we kind of have had the opioid epidemic somewhat in check with a better economy. We not only just restricted people, we've kind of, at least for a good 5-7 years, we've sort of ruined the economy, and people's just their kind of particulate daily lives have diminished because they have fewer resources, lower there was more unemployment for a time. People spent their savings. It's been a kind of a vast issue and problem. But let's get. I'm going to just put up your slide, if you don't mind. About nudges. And maybe you can address what is a nudge, and maybe we can go through some of these without in tremendous detail, because people can always stop and read these on their own later.
Yeah, sure. Well, I think it follows on quite nicely from where I was, really, because I got interested in the COVID stuff. And as a psychologist, one of the things that immediately grabbed my attention was the emotive advertising that was going on, and the kind of frightening images that were being shown on the TV. So I started to revise and dig further into the world of behavioural science and behavioural science nudges. And as you can see on this slide here, the nudges are based on the fact that there are two different types of brain activity, crudely speaking. We can divide it into the fast brain and the slow brain. The fast brain is auto and is effortless, really, and we don't really have any voluntary control over it. Whereas the slow brain is deliberative and lazy and low capacity and effortful. And the fact is that humans tend to spend virtually all the time with the fast brain being at the forefront, and the fast brain is in control, which works pretty well most of the time, because it stops us having to waste time over the minutiae of day-to-day decisions. And usually it can be correct, of course. Like an example I often use is that if everybody's running in one direction and you're walking in the other, it might be useful for you to turn around and follow the crowd. Yeah. So, we're on autopilot, and these nudges, and you can see 9 of them illustrated there, tend to tap into the fact that we're on autopilot most of the time. So these are psychological techniques of persuasion that act upon us largely below our level of consciousness. so we don't know we're being influenced by them, compared to the more traditional way of influencing people that the governments used to use, which was like information, persuasion, and that kind of more obvious, transparent things. We're now into this world where the government was employing a whole raft of behavioural scientists that were nudging us without us knowing to do what they would regard as the right thing.
So can you give us a few examples of what those nudges are or were?
Yeah, I think they're probably on the slides a little bit further on, actually.
Okay. Yeah,
Get to slide 6 if you can. Yeah, so messenger nudge. This is the idea that the perceived source of the message will have a significant influence on the power of it. So if the source is someone in authority, like Witty and Balance were the big guides in our UK system.
Yeah, so just for reference for our audience, Witty is basically Dr. Fauci.
Yes, exactly. Yes, and Balance was our chief scientist. They did these daily press conferences where they tell us about all the scary numbers. So they use their authority. The NHS logo in the UK, people tend to worship the NHS. I think that's fading now, to be honest, but that tended to be the thing. So anytime anybody was giving a message, the NHS logo would be in the background.
Mm-hmm.
Regional accents, we tend to follow people with regional accents. So, things like that. That was the messenger one. The ego nudge, which you can see now, is more important in a way, because I think this one is a questionable ethical basis, really. This is the idea that we all like to see ourselves as a decent human being, a good guy. And therefore what the nudges did was that they made it so that if you followed the rules, you were virtuous and good, and if you didn't, you were a bad guy. You were not virtuous.
No, I heard this all the time. On a personal basis, I heard this all the time. I had people yell at me, and professionals, like people with accreditations after the names MD, MPH, and so forth. At one point, I was at my squash club. I was talking with a mom, and her teenage daughter was on the court, and we were just talking about vaccines, whether they're wise choice for a young teenage girl, given that there's no long-term data, and that young kids already, this is like a year and a half into the COVID, they haven't really gotten sick. This girl had already gotten the natural immunity, and whether it's wise to get a vaccine after the fact, in the case of already having natural immunity. And I was saying, reasonable things. I'm a physician. I do primary care. I've treated patients. I wasn't saying anything untoward. She wasn't my patient. And I was more talking in general terms, not about her child, but about that age group and so forth. And somebody just overhearing this kind of broke in. I peripherally had seen him before, and he's got multiple accreditations, and he works in the public health sphere as a physician and whatnot. And he, not joking, he literally started screaming at me, and how I was killing people. It was just kind of an odd thing. Anyway, I'm sorry to break in.
No, not at all, because I think that's a really good example of the consequence of this as well, Randy, because I think this kind of shaming exercise does encourage vilification of those that are chosen not to follow the rules or chosen not to be vaccinated. What you have up now is obviously affect. This is another nudge, probably the most prominent one, whereby our emotional state has a big impact on how we behave. So what they did is they had all this scary messaging, all this scary kind of data, given to us completely out of context, about deaths today, without saying, they say like 150 people died of COVID today, isn't that terrible? Whereas just in the UK alone, under a normal circumstances, 1,600 people die every day.
Oh, exactly.
Yeah, so this out of context, and this is one thing that is a really kind of scary thing, is that this was strategic as well. If you look at the minutes of one of our major groups of behavioural scientists that were advising the government on the 22nd of March 2020, their minutes actually say, and I quote, the perceived level of personal threat needs to be increased among those who are complacent by using hard-hitting emotional messaging.
Yeah, that's over here on the lower left.
So that was, yeah, so that was pretty clear from the outset, and boy, did they deliver on that. You know, they've scared everybody witless. Again, I won't go into the details, but we've got, I've got a professor of psychology who's doing a lot of work on COVID-19 anxiety syndrome. And there's many as like 1 in 5 back in 2021 had anxiety levels that were of a clinical intensity. The people were scared and still are, a bit less so. But you still see people scared.
Oh, absolutely, terrified all the time. I work in a medical office, and anyway, and elsewhere. I mean, I am probably one of those people. I'm not an actual nudge unit, and if I am, I think I'm doing it in the correct direction to help people a little bit. So at the post office or at the supermarket clerk counter or at the office supply store, I'll see people in their 20s wearing a mask still, and I'll just I do the Socratic method. I'm like, oh, so why are you made to do this at work? And these days people say, no, I choose to do this. I said, oh, that's interesting. So and if I have time, I'll kind of thread out the conversation a little bit. And I'll say, but anyway, the question I think that has gotten generated the most interest from them is, so how long are you planning on doing this? I give a point in the future. Are you planning on doing this 10 years from now? Oh, no, that would be crazy. 10 years from now? Come on, seriously? I said, well, how about 5 years? Like, no, of course not. I said, how about 1 year? They're like, and I said, well, okay, so at some point, there's going to be a time when you think it's absurd to keep doing this. So what is that point? What's going to make you make that mind change? And they're like, oh, and they haven't really thought about that. They're kind of still waiting to be messaged.
Yes, exactly.
to be nudged.
Yes. There's no exit criteria.
Right.
They haven't got any exit criteria.
I mean, it's not like, I understand, mandates and so forth. The example I used last week, I had an interview with a great guy, Jeffrey Tucker, from Brownstone Institute.org. And, we were talking about the last Japanese soldier, how long you remain under those circumstances and what's going to change your mind.
Hello, can you still hear me?
Yes, I can.
Okay, yeah. Just on the previous one, if you just go back to the previous slide, Andy.
Sorry about that.
It's all right. Normative. The other way, I think. Yeah, because the normative pressure is again another key nudge. I think we've used the idea that we all like to be part of the crowd, but none of us really finds it that comfortable to be in a minority. Mm-hmm. And here I'd just like to make the point again. I know I am very focused on masks, but one of the key reasons, and I've no doubt about this, one of the key reasons why the powers that be switched back in early summer 2020, if you remember, Guy Fauci was the same, I was, Whitty was the same. Masks shouldn't, beginning of 2020, masking the healthy is not a good idea.
Right.
It doesn't work. It'll probably cause more harm than good. And then around May, June 2020.
Apparently they did that in part because they thought there were not enough masks for the health workers. They didn't want to create shortage for the health workers.
Sorry, I don't buy that one. I do not buy that one at all, because they could have used that in a much better way. But no, I've no doubt that because masks are such a potent way of enforcing the normative pressure nudge. Because the problem with normative pressure nudges is, you can tell people, large majority of people are supporting lockdowns, and 90% of people are getting vaccinated, and that has an impact, but it's relatively short-lived. And to really bring it home, you need an immediate visual reminder in the real world of who's following the rules and who isn't.
Oh, that's an interesting point. Yeah, fair enough. It's a little bit like, I get that. So it's kind of a uniforming or tattooing or whatever.
Yeah. And I was on holiday recently, not last week. It was in Croatia, but we did a trip to Venice. We drove to Venice in Croatia.
Yep.
And we parked outside of Venice because you can't get parking inside. And we got on the train. And in Italy at the moment, it's still mandatory to wear a face mask on public transport. Now, I was with three fellow kind of like-minded individuals, so the four of us piled on the train. We got away with it. We got some looks on the way in, but on the way back, we got confronted by these two Italian people who were clearly very anxious and frightened. And we're saying, you must wear a mask. We say, well, we've got good reasons not to. Good reasons not to. We don't wear them. Put one on, put one on. So we haven't got one. We've got good reasons not to. Anyway, it's a long story short. The woman stormed off and snitched on us to the guard. Actually, which again, I think captures the kind of what's happened over the last 2 years.
Oh, absolutely. I had. This is a story from probably about a year and a half ago. We have pretty wide streets. We're in a leafy suburb of Boston here, and I was literally, it's a quiet street, so I was walking my dog in the middle of the street, and on the sidewalk, probably about 15, 20 feet away from me laterally, was a woman about 70 years old, and she's wearing a mask, and she sees me, and kind of like Invasion of the Body Snatcher, she points and her fingers, kind of wavering, and she's like, "You're not wearing a mask." And I'm outdoors. There's been zero transmission. Never been a single study showing there's outdoor transmission, especially at that distance, all that kind of stuff. And the odd thing was, as she's doing that, she's totally unfocused on where she's going, and there's just a little bit of grass, like uneven, and her foot steps on that, she falls over. And so it's arguably, her reaction to COVID caused more damage than COVID did. She was fine. She didn't want me to come approach her and help her up, because that would have been worse than falling. But it's just, for me, obviously it's memorable, but it's one of those incidences where, people have this urge. I was not affecting her in any way. And I was far away and so forth, but she needed to point it out and point it out vociferously, a little bit like my quote unquote friend on the squash courts.
Yes. And I talk about these NUDGES, these covert methods of persuasion, and people who are on board with the narrative often say, "Well, what's wrong with that, Gary? It's just getting you to do the right thing." And I have a fundamental problem with that for a start, because my next question in response to that is, well, who decides what the right thing is? I don't remember being consulted about that.
Right.
But just leaving that to one side, there are a number of ethical problems with these. So I don't know whether you just want to just wind on a couple of slides, please, because there are some major ethical problems with the use of these. If we go forward again, yeah, that's the one. Sorry, go back one. That's the one. Yeah, four problems, methods. For me, this. If you think about it, in a civilized society, a democracy, should our government actually be strategically inflicting emotional pain on its citizens as a way of getting them to do what the state want them to do? So I think that's a big. That to me sounds like an authoritarian Chinese-style kind of society, and I think that warrants debate and open discussion. The other problem with the methods, of course, I think you've touched on it already today, is the unintended consequences. Victimization, the collateral damage of people not attending hospital because they're too scared. Old people dying of loneliness in old people's homes.
People not going to school, kids not going to school for 2 years. The scores have gone down.
Exactly.
There's one quick interjection I want to make, because I remember the point I kind of stumbled on it a few minutes ago. In my conversation with Mr. Tucker, I mentioned George Washington's use of smallpox, effectively inoculation, self-inoculation from one person to another, trans inoculation. But smallpox is smallpox. And I've always said, if this were, aerosolized HIV or anthrax, I'd probably dig myself a bunker in the backyard and stay there. But it's not. At worst, and we talked a little earlier ourselves about the Diamond Princess, we had all the data we needed to know right before, frankly, it hit our shores from the January 2020 cruise ship Diamond Princess off the coast of Japan. 3,700 people. Ultimately, there were only 10 deaths, and those were median age 82, which duplicated itself throughout the pandemic elsewhere. And children had no symptoms, didn't even have an inkling of this, and so forth and so on. And the wait staff, the crew, and whatnot, whose median age is probably around 30, had no fatalities, no severe illnesses. So right from the get-go, we knew that our mobile work population, the kind of the strivers who were, waitresses, waiters, FedEx, postal, all that kind of stuff, the hospital, they were not at any risk, and their lives need not have been upended. And we should have done what the Great Barrington Declaration declared, which is focused protection on those real. That's pretty much it, and isolate and so forth. So I apologize for that interjection.
No, I agree entirely. The Barrington Declaration would have been the way, undoubtedly. Yeah. So the other ethical problems I have with it are not just me, incidentally. A lot of us over here, and I hope in other countries as well, have ethical concerns about this. Around consent, you'll know as a practitioner, as a medical specialist, informed consent's the cornerstone of all clinical practice. Whether it's medical or psychological, you can't deliver and shouldn't deliver an intervention without the fully informed consent of the target person. Whereas none of that has been heeded at all during this process, despite some of the major figures in the behavioural science world, like Professor David Halpern, who's the chief executive of the Behavioural Insight teams, one of the big names. If you actually look at some of his books and his writing, he's been explicit that we should not be inflicting these nudges on people without being transparent and having the full consent of the citizens. He's actually said that on more than one occasion, and yet we've kind of gone roughshod over that. And it wouldn't have been that difficult. There are ways of getting consent, even with kind of population-targeted things like this. There's ways, there's forums you can have over weekends where you can get a kind of consensus of opinion as to whether we actually want to proceed with these things. The third ethical issue is around goals. Should we be deploying these covert methods in pursuit of unprecedented, contentious public health goals, many of which, as we've said, have huge collateral damage and infringe upon basic human rights? If the goal was to reduce violent crime, to stop young men stabbing themselves, which is an issue in parts of the UK, I would guess that may well get most people's okay, that you can use these things, the government should use these nudges. But for contentious public health goals, I think that needs debating. And finally, the transparency issue, because these things often act below people's level of consciousness, it does leave them open to the criticism of being manipulative. Something that's acknowledged in the behavioural science world before COVID, that we need to have some transparency. And I'm talking about transparency before you do it. People say, well, how can you covertly nudge someone transparently? You can have a transparent debate about whether we want to use these things, and then if there's agreement, you can go ahead, and people would then be nudged, often without them knowing. If I joined a swimming club tomorrow, what they could say to me is, Gary, one of the things that we use are covert nudges to try and get people to eat less in the canteen and in our advertising material. These are the kind of things we use. Are you okay with that? Now you've signed up to the swimming club, and I could say yes or no. And then after that, they could nudge me to the right if I give my consent.
There's one other point about that and about your last slide, and I imagine it kind of between the lines there is cost. When you sign up for the slimming thing, I assume it's outside the NHS or whatever, you're going to have some acknowledged cost. I think what was a little bit of legerdemain, subterfuge not explained, was the ultimate cost. People were here, we were printing money, we had the stimulus, we had another stimulus, and people were getting free money to be at home and so forth. It's like, wow, this is awesome. And now we have, at least 10% inflation, I mean, there's probably, some other aspects that we're not even come to terms with because the greater deficit and whatnot. So, we're paying probably ultimately 4 or 5 times whatever the stimulus money we got. And so there's, it's just a crazy, bait and switch. I mean, we got the bait and now we're getting the switch, and that's not explained. I'm not sure they necessarily understood it. There's this aspect of public health where the term itself, as a term of art, the public part comes from the same Latin root as politics, the people, and it has political aspects to it that are not specifically kind of health, what we think of science, and that there's almost always a manipulative aspect to it. And again, if it were to save us from an alien invasion or the Earth exploding, I think people would get on board if there were reasonable data in that regard.
Yeah, and I've had this debate, Andy, with colleagues who are generally on kind of my side. We differ. Like I have some colleagues who say that covert behavioural nudges should never be used. Mm-hmm. And I'm kind of going, well, I think it's a bit unrealistic because I think the genie's already out the bottle now, and that these things have been used in private sector and in public sector for many years. So I don't think we're realistically going to stop them, nor necessarily is that desirable, because I do think, but what I do think as a bottom line is that we do need to have this transparent review of the way our government actually uses these techniques upon its people. That's what I'm striving for, and have been for some months, not with a great deal of success, unfortunately, because there seems to be a stark reluctance of the powers that be and the various stakeholders.
Right. So have you heard, lately, forget about it, it's already done, we're moved on? Have you heard that aspect?
Well, you do hear that sometimes, yeah. But even before that, I was banging on about this back again towards the end of 2020, early 2021. In fact, in January 2021, I and 50 odd other psychological specialists wrote to our professional body here in the UK, which is the British Psychological Society, who was supposed to be the guardians of ethical psychological practice in the UK, expressing our concerns, very much like I've done today with the slides, and basically asking their view, and if they had concerns about that, would they, start to get involved in a debate so we could discuss it. And it took 6 months for them to respond and several prompts from us, but eventually they came back and they were just very dismissive, very strident. Our psychologists have done a terrific job during this COVID era. We don't need to get consent because these kinds of decisions are outside the kind of range of individual health decisions. We're doing the right thing. Our psychologists are behaving in a socially responsible way. That's the phrase I keep hearing. I don't know whether you get that across the pond in the US. No, we do it. No, it's a socially responsible thing to do. And I say, well, it's a bit like saying it's for the greater good, which smacks. We were talking about the war times earlier, Andy. That's quite a sinister phrase to me. The greater good. A lot of terrible things. Terrible things have been done.
Yeah. No. Getting back to our friends, the Nazis, not our friends. That's sarcasm. The Jews were basically put in the category of vermin and pests and so forth, and they were to be gotten rid of. And there are ways in which kind of public health is transmuted and misused to get the greater good, and then the greater good gets to be determined whatever it is we want to do. I mean, certainly we see it in a lot of other debates, and no matter which side you happen to be on the abortion debate or this transgendering children, and generally we hear it as the greater good, and I think there's I personally see disfiguring or mutilating or taking away the genitals of a minor as a grave misdeed, and I think the ethicists, honest ethicists throughout history would be horrified, and yet today that is the policy of the United States current government, and it's espoused that nobody should stand in the way of what's called gender affirmation. That's a totally another topic, and almost not quite a can of worms, but but my only point about this is that what is considered the right thing changes. There's not necessarily a fixed right thing, when I think religion oftentimes has a greater sense of what is right for longer periods of time than governments.
Yeah, absolutely. Yeah, I agree totally. And it's and the British Psychological Society were even denying that fear levels amongst the population were elevated. They said they were perfectly consistent with the objective threat posed by the virus. And complete nonsense. It was in the minutes of the behavioural scientists that they were going to strategically inflate fear. Several insiders since, within the advisory groups have actually admitted that they ramped up fear. I've got my colleague Professor Spada from London South Bank who's measured this within our populations. Like I mentioned earlier, around 20% of the population with clinical intensity anxiety disorders. It's absolutely, for our professional kind of body to just completely dismiss our concerns without really entering into any debate.
I mean, oftentimes the level of debate is shut up. So I'm going to just try to go through some of the rest of your slides, and I have one additional one that I put in. It's not your slide. The last slide I'll get to. And we have about 10 minutes left, so I'm going to pop these up if I can.
I've already mentioned that. That was our request to the British Psychological Society. We also tried to get the government to do an independent review as well, but they're not interested either. So they've no intention at this particular moment. These are just a few of the comments from behavioural scientists. Some of them before the COVID era, of course. This is David Alpen, 2019. If governments wish to use behavioural insights, they must seek and maintain the permission of the public. Can't be clearer than that.
Right.
Can't be clearer than that.
Right. I just want to point out that Cass Sunstein, I think he's local to the Boston area. He's a lawyer and very prominent politically, very bright guy, and he's a Democrat. He's not of the right, and so in 2016, I'm not sure what he was talking about, but a nudge is unethical if it doesn't sufficiently draw upon deliberative processes. Yeah. So I think that's a very interesting point.
Yeah, I put that up there. This was just a list of comments from people in the field about the ethics of it.
It'd be interesting to hear or read what he said about this, because people oftentimes their barometers change. In the United States, they in the run-up to the 2020 campaign, both our current president and vice president said that they would stay away from vaccines because they were developed under the Trump administration. They couldn't be trusted. And how would we know? They've been verified. And as soon as they were in power, they say retroactively, I guess all those things were trustable or trustworthy.
Yes. Yeah, it's just this first quote was from Laura Dodsworth's book, which I don't know whether you've come across that in the US, The State of Fear. The State of Fear. She did the investigative journalism that our mainstream media failed to do, and actually managed to interview some of the people on the inside of these advisory groups, including a number of behavioural scientists who were acknowledging that they ramped up fear way beyond what was reasonable. The way we have used fear is dystopian, one anonymous one said. So yeah, that was just to give a flavour of some of the kind of perspectives about the ethics, the lack of ethics of these things. Simon Ruder was a previous behavioural insight team member, one of the founder members actually. And he said recently that the most egregious and far-reaching mistake made in responding to the pandemic has been the level of fear unwillingly conveyed on the public. So for the British Psychological Society to deny that fear was elevated just seems laughable, really.
So I'm going to pass over these because I think people can pause and look at it. I just maybe we go to your goals and then.
No, these are just the things that in Panda, with colleagues in Panda and colleagues elsewhere, that we're trying to achieve now. Really, the first is we need to just find out what's actually gone on. We need to try to quantify the extent of state-sponsored behavioural science, because these guys and lasses are in every nook and cranny of our government at the moment, and that will be the same in America as well, undoubtedly. You know, I know you have two offices of the behavioural insight team in America. You have one in New York and one in Washington DC, and so they are active. They're in every department in the UK, and we need to know how much we're spending on them, where they are, and whether as voters and taxpayers we actually want them there. So we also need to know who made these decisions, who actually decided on these scare tactics. And as I've tried to describe elsewhere, we're trying to do that at the moment. Everybody's turning their back on it and saying, no, nothing to see here. It wasn't me. I didn't do that. Well, I even had a message from somebody at the behavioural insight team, personal message saying, no, I've read your letters, and just to say all this scaremongering and nothing at all to do with us, we never would do anything like that. It then begs the question, well, if it wasn't, you know, the behavioural insight team, if it wasn't the behavioural scientists on the group advising the government, who the hell was it? You know, where are these decisions being made? I think we need to find out where those decisions are being made.
Well, I think the template was there in advance. And it's interesting to me because the UK had basically its right of center, its conservative government up, and we had at one point, you know, our right of center, and then now our left of center government up. And you know, Canada was left of center. I think Australia was right of center. New Zealand was left of center. But it didn't really matter, aside from the UK originally, which I think showed some bravery, and it sort of fell along with Boris's you know, bravery with his actual own physical illness of COVID. But you know, it was irrespective of the leaning of the government. Everyone seemed to have the same template already in mind. And there's, you know, I'm not a conspiracy guy, but I do think that there were influences across the board, and there's kind of a transnational aspect to this where they're getting their blueprint not from the populace. There were some places, very, 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 very few, that acted bravely. I think you know, Sweden, you know, stands out, but there were other places for whom this was not really even a problem. All throughout kind of equatorial Africa, you don't really hear much about COVID, and all to the good. I mean, they don't necessarily have this on their scale of problems. You know, back in medical school 1,000 years ago, I heard from a lecturer that, you know, our diagnosis of lumbar, you know, sciatica was not really seen very much throughout large swaths of Africa as a problem because, you know, people don't have the ability to take time off or get a disability at the time. And so they didn't, you know, it's not a diagnosis. People understand they get pains and they just kind of carry on. But here we kind of take time off. We have all kinds of adjudication and we have disability payments. So it becomes a thing because there's a thing. That's very imprecisely said. But, you know, so these.
But like you, you know, I'm not a conspiracy theorist either, Randy. In fact, I'm the furthest away from a conspiracy theorist could ever be. I'm 63-year-old now, and up until 2020, I'd never been on a protest at all. I got my head down, worked hard, and assumed that what I was being told by the state and others was broadly true. And then this came up. You know, at first I tried to dismiss it as incompetence and panic. That's all, incompetence and panic. That quickly became insufficient to explain the coordination of it. So I thought, okay, it's incompetence, panic, and some opportunistic agendas have jumped on as well. Yeah, that's what it is. But I'm afraid at the moment, no, this globalist influences here.
Yeah, that's the crazy one. I mean, there has been some aspects that are not lockstep, and I do think currently China, you know, they should be actually just doing a victory lap, a political victory lap. They got rid of their biggest adversary, Mr. Donald Trump, or whatever. You know, I'm not saying they did it per se, but as events unfolded from Wuhan outward, for whatever reason, whether deliberate or not, they achieved, you know, kind of the chopping down of our economic success. We were at the peak, you know, efficiency, lowest unemployment, highest rate of growth, you know, leading the world. It's boom, that's all gone. So rather than doing a victory lap, they're doing zero COVID, you know, locking their own people up in Shanghai and creating their own economy. It's a weird thing. Somebody once wrote that anti-Semitism is its own punishment, because ultimately every place that's virulently anti-Semitic, they die under their own poison of their own bile, and it's just kind of a funny thing. This kind of COVID thing, this huge zero COVID aspects, they wind up falling under their own weight. So I mean that's the morbidly good news out of this. I don't have too much Schadenfreude because I don't want other people to suffer per se. I just wanted to, maybe we have a couple minutes, and I'm going to give kind of myself promotion. I add this slide here that I apologize for the crude aspect of it, but basically, I need to make a better one. I just dropped this out from Our World in Data website, and I couldn't find exactly what I wanted. But these big markers up here, 40, 20, 10, that's the case fatality rate. And over time, the presumed case fatality rate from early on, they had no idea what it was. It was way up a high number because they didn't do much testing. And so whomever they tested, was very, very ill. But over time, they got more tests, and obviously the case fatality, they found more cases that are outside the hospital. The case fatality rate goes down and down and down and down. So over time, it has been dropping. It's really hard to read from this, but basically, this crowded area over here is a bunch of other countries on this graph, but all the countries are dropping down. I isolated the UK because they have relatively good data, and they didn't pollute their data by giving financial incentives as we did to hospitals to make the diagnosis and patients, so forth. So over time, it's hard to see it, but this is down at 0.5%, and now it's lower. So the case, this is even including all the initial when COVID-19 was COVID-19. Now it's what I call COVID-22, which is kind of the puppy, dachshund, poodle version of what was the original wolf that came in. And so the messages didn't really change that much, and there's still fear messages, even though it's kind of like what they say about spring comes in as a lion and leaves as a lamb. And so now we're kind of in the lamb, puppy poodle stage of COVID. Not to say some people can't get bitten by a poodle or trip over a lamb or whatnot, but it's not really in the stage that's very far above, colds and flus, of which we've learned somehow, to suffer through over the years.
Precisely. Yeah.
So we have about a minute or 2 minutes left precisely. So I'm going to leave, say, a minute to you to give everyone your thoughts, ideas, and advice.
Well, I suppose my pressing issue at the moment is to find out what's gone on with regards to the use of state-sponsored nudging. I think we've got a right to know. I think we've got a right to know what our governments are doing to its peoples. So I just urge everybody to start getting curious and do a little bit of reading around this, because I don't think people realise the extent of manipulation that we've all experienced over the last 2+ years. And I think if people started to read and started to just dig a little, I think they would, more and more of them would get curious, which would be good. Because I think to stop, because I think we're not out of the woods yet by any means. I think you're right. As far as COVID's concerned, we're into the Omicron variant and much less kind of risky and so on. But that's not the point. I think there are bigger agendas playing out here, and the key one is a globalist one. Mm-hmm. And I think if people out there want to fight for the basic rights that we've had in Western democracies, I don't think I'm overstating it. I think they do need to make the descent to this authoritarianism much more visible.
Is there a place they could contact you, or from which you'd like to be contacted?
Well, they could contact me through smilefree.org, which
fair enough. So I'll put a link up for that. So I'm going to take the last minute myself, and I'm going to give a shameless self-promotion here. This is my book. I hope it's not on mirror image. It's Overturning Zika. And the subtitle, I think, is quite pertinent: "The Pandemic That Never Was." If it's not a conspiracy book, Zika is much more encapsulated. It was there, it's gone. Nobody really knows what happened to it. The specialists and experts I've asked, they have very disparate theories. So I'm going to leave it there. You can go look at that, find that book on Amazon. And I'm going to be very grateful for Dr. Gary Sidley for having been on our broadcast. Thank you very much.
My pleasure. Thank you for having me.